Hey everybody, this is Dr. Joe from Fargo Spine. Just wanted to touch base, talk about some new things that we have in the office. As you can see right here, this is the new machine we have. This is called piezo wave or shockwave therapy, or sometimes we call it Softwave therapy. There's a lot of people in the area that have different machines that, out there on Facebook and on their websites that are talking about, Softwave therapy. Just wanted to go through a little bit of differences between those types of therapy and why this machine is quite a bit better in terms of treatment protocols as well as results. So this is basically the piezo wave. We like to call it shockwave therapy just because it does a really good job with neuromuscular or any type of myofascial issues that you may be having. It works really well with plantar fasciitis. That's what we're going to treat today. Currently we have a patient here that we've been treating for myofascia or plantar fasciitis. I just wanted to give you a heads up on what she's dealing with. As you can see right here, she has quite a large spur in her heel. Her pain's been there for, how long would you say this been there? About 2 months?
2 months.
About 2 months. We've done 2 treatments with Shockwave. And how much reduction in pain would you say you've had so far?
Probably about 40%.
So she's about 40% reduced pain just after 2 treatments. So I'm going to kind of walk you through kind of how it works, and then the differences, like I said, between focused shockwave therapy as opposed to soft wave therapy. Both are pretty much the same thing. The only differences is that this machine can actually, it treats lower body injury a little bit better because it has more of a focused wave. The wave is a little bit more focused, so you get better depth and also pinpoint accuracy to where those myofascial issues are, those small little adhesions and things like that. So let's go ahead and get this thing going. So I have the machine. We're going to go ahead and set this up. Basically, I'm going to use the pinpoint apparatus that we have here. I'm going to set the machine up to where we need to have the intensity as well as the frequency. And then we'll use our lithotripsy gel. And then we'll go ahead and go through some of the treatments the treatment that we're going to do here. So I'm going to go ahead and put this right on there. And then we'll go ahead and just get this thing started. So you can see it's pretty easy here. We also just go ahead, get this kind of dialed in here. We'll hit the button. You'll start hearing some clicking. And at this point, we're asking the patient how she feels, if there's any type of point tenderness. We're looking for those really deep points that could be of pain. Now, the pain scale we're looking for is somewhere between like a 6 and an 8 or a 5 and a 7. We don't want to go any more than that because we're creating micro trauma with this machine, right? So we want the body to reflag the area and then bring in its normal immune response cells and things and clean it up and regenerate and heal, okay? So how are we doing? Any pain at all here?
Slight.
Okay, so about a 3. Okay, so we're going to move around, try to find those areas. And I like to ask the patient where to go. This is the real nice thing about this machine is we're communicating back and forth to tell me where that pain is the worst. So we're going to try to get right up where that heel spur is. So I'm going to sneak up here a little bit.
Yep.
Okay.
About a 5.
So we got a 5 out of 10 there. So I'm going to hold there. We're going to try to treat that area until she feels a decrease in overall pain and or we get to between 200 and 400 beats. So how's it now?
It's about the same.
About the same. So we're going to continue to hold that point. Maybe move this around a little bit to get a different angle on it. See if it's any worse, any better. How are we doing?
It's all right, but I would say it's less pain.
Okay, less pain. So I'm going to start moving over here. We've had about 200.
Yep, right there.
Okay, so now we got,
6.
now it's a 6. So we're going to go ahead and do this. So we're going to do this for this treatment for approximately about 1,500 beats on this foot. And then we'll go ahead and see her back in a week. And that's what we're going to do in terms of treatment protocol. It's once a week for 6 weeks. And she's, like I said, 2 weeks later, we're only into the treatment for 2 weeks, and she's already 40% reduction in pain. And we like to really see 100%, 90% reduction to 100% reduction. And a lot of times that takes about 5 to 6 weeks. So she's on her way. I just wanted to kind of highlight how we use the shock wave or piezo wave, or some people call it soft wave. That's kind of where we're at right now. So if you have any questions, you can go ahead and call the office at Fargo Spine, ask for Dr. Joe, and we offer free scans to see if this is a machine that can help you. So go ahead and call Fargo Spine, like I said, ask for Dr. Joe, and the Shockwave machine, or the Softwave therapy that's called as well, or all the names that are out there, you can just go ahead and our staff is versed. We know what you're trying to ask. You can check us out on Facebook as well, and we'll go ahead and we'll see you back in our next video. All right, thanks.